Hyperbaric oxygen therapy and its use in veterinary neurology and neurosurgery is a presentation of the American College of Veterinary Internal Medicine 2017 Forum. The American College of Veterinary Internal Medicine is responsible for the training, certification, and supervising overlooking the veterinary specialties of small animal and large animal internal medicine, oncology, cardiology, and neurology. You can find the ACVIM and all its information and support to the community at acvim.org. My name is Dr. Anne Chauvet, and I am one of the associates at PET International Neurology Consultant. Veterinary Neurology Without Borders, because keeping families together matters. Please visit us at veterinaryneurology.net. Our goal in this presentation is to review a brief history of hyperbaric oxygen therapy, to explain the physiology of hyperbaric oxygen therapy, and explain the options of the different chambers available. We will, of course, focus on the benefits of treating disorders with this modality, including neurological and non-neurological disorders. Once upon a time, long time ago in the past, there was a clergyman, British fellow, named Henshaw. He used a system of organ bellows to change the atmospheric pressure in a sealed chamber that he called a domicilium. He used hyperbaric, which is increased air pressure, to treat acute condition, and hypobaric environments, which is decreased air pressure, to treat what he considered chronic conditions. Henshaw was only providing increased and decreased air pressure. He really did not work with any oxygen concentration. Oxygen was only actually discovered in 1773 by Swedish pharmacist called Carl Wilhelm Scheele. The term oxygen was not even coined until 1777 by a French chemist named Antoine Lavoisier. The rebirth and interest in hyperbaric medicine restarted again about 1834 in France. The French physician Junot built a hyperbaric chamber to treat pulmonary afflictions using hyperbaric pressures of 2 to 4 ATA, and he reported quite good success with an increase in circulation of the internal organs, an improvement of cerebral blood flow, and production of a feeling of very good well-being. In 1837, Pravas built the largest hyperbaric chamber of its time and used it as well to treat pulmonary conditions. 1860, the first hyperbaric chamber in North America continent was constructed in Oshawa, Ontario. Later, it was moved to New York to treat nervous conditions. Fontaine came about in 1877 with the first ever mobile hyperbaric operating center, an operating room that took advantage of the basic law of physics. And he focused mostly on Henry's law, which we'll review in a bit. The chamber was recommended to facilitate the reduction of hernias and for patients with asthma, chronic bronchitis, emphysema, and anemia. Over a 3-month period, 27 operations were performed in its mobile hyperbaric chamber. It was a great success. An amphitheater was planned for 300 people. But it never came into being because Fontaine became the first victim of a hyperbaric accident, and the Pneumatic Institute considered him to be the first physician martyr of the hyperbaric chamber. And we moved to the USA in 1921 at the end of the First World War. Orville J. Cunningham in Lawrence, Kansas, was dealing with the Spanish influenza. He realized that the patients that were at a higher elevation had a higher morbidity and mortality. The atmospheric pressure or barometric factors were considered, and he realized that maybe the hyperbaric environment might be the answer to a lot of people's worries. So he built this wonderful facility and started treating people over a fairly long-term basis. Unfortunately, one night, mechanical failure caused a complete loss of pressurization, and all of Cunningham's patients died. He went on to treat diseases such as syphilis, hypertension, diabetes mellitus, and cancer, and he was one of the first people to believe anaerobic infection played a role in the etiology of such diseases. In 1928, Cunningham built the largest hyperbaric chamber in the world, and probably to this day, in Cleveland, Ohio. This hyperbaric hotel was a 5-story high steel sphere, 64 feet diameter. Each floor of this massive hyperbaric sphere had about 12 bedrooms, with all the amenities of a nice, good hotel. The growing awareness of Dr. Cunningham's treatment prompted repeated requests by the Bureau of Investigation of the American Medical Association to validate his claims regarding the effectiveness of hyperbaric therapy. Some believe he simply did not want to share or cooperate with AMA. Others believe he was just a total fraud. Well, the result ended up that he was asked to dismantle his chamber, and in 1937, that chamber was sold for scraps for World War II. Haldane, in the 20th century, was our next stopover. Decompression tables started happening. They were now becoming real. The U.S. Navy dive manual came about. In 1939, U.S. Navy began treating divers suffering decompression sickness with hyperbaric oxygen therapy. This was very different than the previous uses of hyperbaric therapy because now we were not dealing with just compressed air. Borima created the first competent surgical chamber that was actually with oxygen. This happened about the 1950s in the Netherlands with a collaboration of the Royal Dutch Navy, and the idea was to flood the body tissues with extra oxygen. The results were so successful that a large operating hyperbaric chamber was built right in the University of Amsterdam, where it could perform a number of complicated heart and lung operations. Borima and his team were the first to treat clostridial myonecrosis, also known as gas gangrene, with hyperbaric oxygen therapy using an experimental pig. He also published Life Without Blood, a report of fatally anemic pigs treated successfully with hyperbaric oxygen therapy. These pigs were able to thrive within the hyperbaric chamber, even in a complete absence of circulating red blood cells. The Undersea Medical Society, an organization made of largely Navy and ex-Navy physicians, was founded in 1967 in the USA. Undersea and Hyperbaric Medical Society followed closely. A committee of hyperbaric oxygen therapy in the late 70s was formed and systemically reviewed all the available scientific evidence for hyperbaric oxygen therapy. They came upon a list of conditions for which the hyperbaric oxygen therapy was likely to be beneficial. That list is still in existence and provided to insurance providers, including Medicare. In 1972, Dr. Richard Neubauer opened the Oceanic Hyperbaric Neurological Center in Lauderdale-by-the-Sea. Neubauer is considered the grandfather of hyperbaric oxygen therapy in neurology. Dr. Paul Harsh began an in-depth study of the brain decompression illness and evaluated divers with this disorder. He found that it was not residual gas being treated, rather it was ischemic brain injury. 1990, former microbiologist Professor Igor Gamov created the Gamov bag. This low-pressure hyperbaric bag provided high-altitude climbers with an effective method to treat high-altitude sickness. An inflatable bag that could be inflated by 2 pounds per square inch of pressure, this bag simulated descents and helped save many lives and is still in use this day. So how do we do that? How do we do hyperbaric oxygen therapy? The rationale between hyperbaric oxygen therapy is the laws. We have 4 major laws to consider. One is Boyle's law, where the volume of gas is inversely proportional to the pressure under constant temperature. We have Charles' law, which sort of twists that around. With a body of an ideal gas at constant pressure, the volume is directly proportional to the absolute temperature. We have Dalton's law, the sum of partial pressures of gas in any mix is equal to the total pressure. 2 plus 2 equals 4. Henry's law, where partial pressures of gas dissolved in a liquid is equal to the partial pressure of the gas exerted on the surface of the liquid at equilibrium. Talking about oxygen transport, it's important to realize that oxygen in the body is transported by red blood cells and the hemoglobin. 97.5% of it is via hemoglobin and less than 3% is in plasma. In 100 ml of blood, 19.5 ml are passing through the capillaries and about 5 ml actually going to be carrying enough oxygen to the tissues. If you increase the atmospheric pressure, you increase the plasma concentration. You will increase the delivery to the mitochondrium and other cellular organelles responsible for the survivals of the cells. The oxygen is 100 times more concentrated in plasma than on the red blood cells. Patients can survive with no red blood cells, as you remember from Borima's studies, and only plasma oxygen. This can be super important in our possibilities in medicine of treating patients with hypoxia and other ailments. The delivery of oxygen to hypoperfused tissues is a very important factor of the success of hyperbaric. The availability of the oxygen in tissues that are not well vascularized will limit ischemic damage and limit cell death. Collagen formation is promoted and angiogenesis begins. The presence of oxygen leads to a drop in lactate and lactate acidosis. One of the great concerns with oxygen therapy has always been oxygen-free radicals. Well, we found that actually they can be of benefit by killing oxygen-dependent bacteria and facilitating the transport of antibiotics to the area of need. Vasoconstriction is one of the side effects of hyperbaric that is actually one of its pluses. What happens with vasoconstriction is that you can begin to limit things like edema, tissue swelling, and you can also limit adhesion of the leukocyte degranulation and therefore decreasing inflammation. An increase in oxygen tension will increase antibiotic delivery as well stimulate angiogenesis. Of course, important for divers and nitrogen bubbles, the hyperbaric oxygen therapy will shrink the bubbles. Now, it's important to realize that oxygen bubbles do not have serious side effects because oxygen dissolves so rapidly in the body. Nitrogen, however, does not, and that is seriously damaging to the body. Remember that oxygen is carried at over 100 times in the plasma than in red cells. Its availability to tissues all over the body, especially at ATAs of 1.75, 2 and above, is going to be extremely high compared to a regular physiological body at regular atmospheric pressures. Decreased intracranial pressure, reduction of brain inflammation, and inhibition of apoptosis are pivotal to the success of treatment of traumatic brain injury. Neurogenesis and angiogenesis can be also pivotal for the treatment of brain cancers, for example. Let's take a look at dives and ATAs. So in the terms of hyperbaric oxygen therapy, we go for dives. The dives will include the diving portion, the descent, staying at atmospheric pressure, the actual treatment time, and of course the rise. When we talk about the time of treatment, let's say 90 minutes, it means we have 15 minutes descent, 60 minutes at atmospheric pressure desired, and 15-minute ascent. That allows the patient to regulate, decompress, and come back to stability. Again, remember, there's very little risk of decompression sickness because oxygen dissolves super fast, so that is not usually a great concern. Most dives are done at about 2 ATAs. 3 ATAs can be done in more experimental, but there can be some side effect of oxygen toxicity, one of those being seizures. Timing of the effect of hyperbaric oxygen therapy. Immediate effects are reperfusion of dead tissue, oxygenation to tissues that would not otherwise see vascularity. The late effects is wound healing. In between is infection and inflammation. What are the risks of hyperbaric? Well, here is a list that is provided to us, but truly and honestly, other than having collapsed lung, bullets in the lung, or some other risk of rupture of any pulmonary organ or possibly middle ear disease, there are very little risk to hyperbaric oxygen therapy. I've treated many patients with sinus issues, middle inner ear disease with no consequences and no worsening nor side effects. One thing I've noted, however, is that cataracts can seem to worsen with hyperbaric oxygen therapy. As well, it is not recommended to put patients with arrhythmias in a hyperbaric oxygen chamber. And I mean certain arrhythmias, because when you look at patients, for example, with splenectomies or GDVs that have arrhythmias due to hypoxia and pain, these patients benefit from hyperbaric oxygen therapy tremendously. Take some cautions though. Make sure there's no collapsed lungs, take good chest films, make sure you have a good physical exam, and that you watch what the condition you are treating for is. Claustrophobia is not a huge problem in animals, and it can be managed with a light sedation of azithromycin. Here are some of the ailments that are permitted by insurance carriers and Medicare to be treated. Air gas embolism, carbon monoxide poisoning, clostridial myositis, crush injuries, decompression sickness, arterial insufficiency, anemia, intracranial abscess, necrotizing soft tissue infection, osteomyelitis, delayed radiation injury, compromised skin grafts, acute thermal burn injuries, idiopathic sudden sensory neuronal hearing loss, which is fairly newly approved. There are other things coming on that list, and you'll see as I talk about later in the lecture. What do we treat off-labels? Autism, ADD, ADHD, RAD, cerebral palsy, Lyme disease, migraine, multiple sclerosis, fibromyalgia, near-drowning, recoveries from plastic surgery, orthopedic surgery, sports injuries, strokes, traumatic brain injury, etc., etc., etc. So let's talk about the chambers that are available out there. What's in the market for us? Not all chambers are created equal. So this is a great example, a chamber from Alibaba.com, where you can see this is an inflatable chamber on a support that is provided with an oxygenator. This type of chamber and all those monoplace inflatable chambers are going to be bringing up probably about 1.3 to 1.4 ATA. That is not considered hyperbaric. To be hyperbaric, the chamber has to reach over 1.4 ATAs. Now, these chambers will make the patient feel good, but they will not be able to treat deep-seated infections, brain injuries, traumas, or anything that requires a deeper penetration. So what are your options? Well, remembering that this is 1 ATA sea level, we want to really bring that pressure in. So we're going to be looking at monoplace chambers, for example, like this one. Many companies make them, where you have the ability of providing the liquid oxygen right into the chamber. The patient is laying down and breathing the oxygen directly. There are no leaks. There's no error. We know exactly where the pressure is, and we know where the patient is at. This is a multiplace chamber where, again, the oxygen is fed within the chamber, and the chamber entirely is pressurized of oxygen. To be more economical, there are situations where the oxygen is actually given through a mask, and you will see in these patients that a mask is provided, and the patient is breathing oxygen while the chamber is compressed air and brought to proper atmospheric pressure. There's going to be leakage in this system, so we don't really know how much the patient is getting of oxygen. Do we actually reach these ATAs and pressurized oxygen within the body that's sufficient enough for treatment? That's a little bit up for grabs. We've moved on to the next step, which is wearing a hood, and that hood provides oxygen. The chamber, again, is compressed air. This is a little bit better than the last option, but there are still leaks. Actually, you can measure the oxygen within the chamber. It goes up, therefore recognizing there are leaks from the hood, and therefore we will not be reaching the appropriate pressures. This is certainly more economical and better for a business perspective. The technician is not wearing a hood. This is not hyperbaric oxygen therapy, so the oxygenator with a plastic bag, a piece of tape, or the cat anesthesia box, or that's not going to work. So don't even think about it. That's not going to work. It's not the way you do it. And no. Chambers for equine. This is a single place chamber for equine. It's very important that when you put the animals in the chamber, they get wet down a little bit to get rid of the static. No metal. Everything that's on them has to be cotton. Cannot put any synthetics. If you have to put an e-collar on a pet, it has to be plastic, nothing synthetic or nylons or so. These chambers are very nice. Unfortunately, it's a large volume of oxygen, so that's fairly expensive to reach the proper pressure, but it certainly is comfortable for the horse. Another method is relating to what's done in humans. These are multi-place chambers where the horse is breathing oxygen through a mask, and the chamber itself, the air is compressed. These are the typical chambers for dogs and cats and for small animals. In this chamber, you can put one large dog or two small ones, as you'll see. You can pressurize the entire chamber with liquid oxygen. It is a small enough space that it's very feasible, large enough to accommodate up to a Saint Bernard size. So these are the more run-of-the-mill. There are two major companies in the market, HBOT and right now Seacrest. I'm sure many others will break into this veterinary market. Here's a chamber where you can see the pod situation. You can place two animals in the chamber separate from each other. The acrylic pod has holes all over it so oxygen can flow freely. So what are the neurological, non-neurological applications? Well, let's start with the non-neurological applications. One of the greatest things that we can use hyperbaric oxygen therapy for is wound healing, whether we're talking at spider, snake bites, bite wounds, skin graft, degloving injury, dental disease, post-dentals. Lots of other things can be addressed. Any wound, any abscess should be addressed with hyperbaric. It is not the cure-all and will not replace antibiotics, will not replace draining abscesses, but it will speed up the recovery and help the patient feel a lot more comfortable. Dog bites. Let's take a look at a particular case. This is a small dog that was bit by a large dog. This is the arrival. You can see the wounds look like giant holes, but we do not see anything much under. The wounds were cleaned under anesthesia. Pain management was administered. After 1 day, you can see the wounds have been cleaned. They've been sutured. There's a little bit of darkening around the incision on the left side, but overall nothing alarming. Patient is still uncomfortable. Hyperbaric therapy has been started at 2 treatments a day. 90 minutes at 2 ATH. 48 hours later, the incisions are failing. Necrotic tissue is falling out, holes are forming. We call this a dehiscence. Anesthesia is performed, cultures are taken, cleanup, starting with honey, sugar, wound bandages, and tender loving care, including pain medication. On day 4, the wounds are starting to look more granulating. There's been a tremendous amount of tissue that had to be removed. That was what we call necrotic or dead. The pain is managed systemically, and hyperbaric oxygen therapy is continued. The patient is more comfortable despite the ugliness of the wounds. This is on day 6. We see a lot of granulation tissue, including the proud flesh, which is that little nubbin of tissue sticking out on the left side. You can see on the right side there's a large gaping hole. You can see the nice anatomy of the muscles, but the edges of the skin are clean. There's no more black dead tissue. Day 15, we have begun to treat with some A-cell application powder, continued bandaging, and we see wonderful healing, some magnificent granulation, and you see an edge that is nice and white around the wound, and that's showing some constriction or some healing, what we call second intention healing. Ready for skin grafts, going to surgery. You can see the skin grafts are being applied. Here we look at our little guy. About 2 weeks post-op, everything is looking beautiful. There are no complications. Hyperbaric has been continued. Total healing, 1 month. Many of these types of cases can take a lot longer to heal, develop secondary infections that go systemic, and it can be quite a disaster, not to mention the expense to the owner. So the faster we can get these wounds treated, the more affordable it becomes to the owner. The effects of hyperbaric oxygen on full-thickness mesh sheet skin on the grafts applied to the flesh and the granulated wounds in horses has been studied. There's a number of articles about skin grafts and healing that are available out there in the literature, both veterinary and human. So here's an example of skin graft. So we're looking at decubital masses. This means elbow masses. They can be very inconvenient, whether they're hygromas, which is fluid pockets that grow right over the area of the elbow because of weight, large dogs. It can also be, as in this case, sort of a papilloma type situation. And you see a healing time same as other skin graft, but no complications at all with hyperbaric oxygen therapy. As you can tell, in this dog, after getting its flap, A few days later, there's absolutely wonderful healing, no blackening at the area of the incision, no evidence of necrosis. This patient healed within 2 weeks without the need of a donut over the elbow to take the pressure off, and you could absolutely not tell that there was a skin graft there. So hyperbaric oxygen therapy really promotes healing and makes things look really good for the surgeon. Here's an example of a cancer at the level of the elbow that was removed with a similar skin graft. And again, the patient is looking wonderful after just a few days. No consequences of the skin graft being placed, the elbow location. Everything is healing beautifully and did not have to look back. The big one we see in Florida and many parts of the southern United States is snake bites, particularly Crotalus or rattlesnake. Here's a dachshund presented to the clinic, and on arrival is a very swollen face as it kissed the Crotalus, or the Crotalus kissed him. You can see the swelling, particularly on the right side of the face, over the eyes. The whole nose is swollen, treated with IV fluid, 1 dose of antivenom. Class 4 laser on the swelling of the face has now been reported to be helpful with snake bites. Arnica montana for trauma, and 90 minutes at 2 ATA every 46 hours for the first night. This patient only got 2 treatments of hyperbaric. Here's after the first treatment. There's barely any swelling left. Second treatment, there's almost no swelling left at all in this patient. Went home within 24 hours, which is very quick for a snake bite. Here's another couple of dogs, a little less lucky this time. These 2 family dogs were bit on the face by a rattler, picture of the dead rattler. 2 days at another ER, treated with 2 doses of antivenom each, IV fluids, anti-inflammatories. They were admitted in our clinic with 1 dose of antivenom given to each dog. Was started in hyperbaric oxygen therapy, 90 minutes at 2 ATAs twice a day. Here are the patients 24 hours later, significant decrease in swelling. The dog that was the most swollen upon admission actually is looking the better, which is a brown dog. The brown and white dog still has substantial swelling, but is much more comfortable. The cherry eye, note that. We did not treat this surgically. Just keep an eye on the cherry eye. The brown and white dog also developed thrombocytopenia, which is not unusual with progressive snakebite lesions, or rather snakebite incidents. 48 hours later, a brown and white dog is responding to treatment for the thrombocytopenia. Swelling is substantially reduced. Both dogs are very comfortable. Attitude is improved. On day 4, brown dog is going home. Thrombocytopenia is worsening in the brown and white dog. Started to give blood products. In snake bites, it's not unusual, especially Crotalus, to get a biphasic thrombocytopenia. And this dog was managed for just that problem. Hyperbaric oxygen therapy is continued for both dogs. A week later, all total a week, so brown dog went home on day 4, a white and brown dog went home on day 7, and here they are in the car of their owners, doing amazingly well with absolutely no evidence of their issues. Spider bites, recluse bites, is one we see a lot. The nest of recluse for this dog. You see that there is a constant, very large swollen elbow on the right, and there is necrotic tissue on the left pelvic limb due to recluse. These spiders bit this dog early in the morning. That's when the sitter realized the swelling was starting, and by the evening this is what we had. So shifted to us from another emergency. A day later, with hyperbaric oxygen therapy after a thorough cleanup, you can see that the left pelvic limb is healing beautifully. The little speck of white is actually tendon. The elbow, unfortunately, needed to start being drained, and a large amount of purulent material was removed, which is pus. Drains were put in, and we continued with some honey bandaging, of course, and some cultures. Day 2, cleanup continues. On the upper left, you can see the left pelvic limb looking beautiful, nicely vascularized, tissue is growing. On the right bottom, you can see that there's a gaping hole in the elbow area. Drains were removed. We continued with honey bandages. Flushing of the elbow is being done every day. and monitored for infection. Again, we can see the left pelvic limb, this time on the bottom right, is healing beautifully and contraction is starting to happen. There's really no room for skin graft at this level without causing some more problems. Otherwise, we would have probably proceeded with a skin graft. Day 6, we have a secondary infection in the left pelvic limb, deserving some drains and some flushing. The elbow is healing nicely. You can see the white material is actually gauze right inside the wound with honey wraps. Hyperbaric oxygen is continued. Day 16, the elbow has been debrided and closed, and the left pelvic limb is almost fully healed. We're looking at day 21. The elbow is just about healed. We're just leaving some stockinets on it so the patient does not lick it. And we have a exposed left pelvic limb with some contracting tissue, second intention healing, on its way to full recovery. Osteoarthritis. Yeah, chronic arthritis in dogs. We had no idea this was going to be a good hyperbaric oxygen therapy type disease. So we have this dog that came to us for spider bites and responded very well to the treatment hyperbaric oxygen therapy. The owners felt the dog did really well psychologically and energy-wise and asked if we could put her in a hyperbaric oxygen tank in order to help her with her energy level as she was getting older, not jumping in and out of the car, kind of getting weak. So we advise ACVIM at a standard protocol as listed, and we recommended laser therapies on the big joints on the days of the ACVIM, and suggested that we could go ahead and do hyperbaric so she could feel good. Little did we know that in only after a few treatments, this dog was jumping in the car, trotting, and feeling like $1,000,000. Here's an example of a patient that we saw that was treated just for that problem, different dog, and this is after only one hyperbaric treatment. You can tell this dog has a whole harness to help the owners lift him off the ground, in and out of vehicles. The dog had to be assisted to walk in the exam room, and here's our patient. Thank you for your patience. There we go. We see a bunch of energy. This dog is ambulating by himself. Pancreatitis. Pancreatitis is treated as a regular basis with hyperbaric oxygen therapy in facilities that have access to it for human patients, and highly recommended for veterinary patients as well. It is our opinion in our emergency critical care hospital where I have worked before is that pancreatitis, acute or chronic, will respond substantially to hyperbaric oxygen therapy with alleviating pain, decreasing inflammation, and continuing to help with the healing. This dachshund was afflicted with hepatitis, pancreatitis, and later gallbladder rupture. Patient was doomed to not be around for about a year and continued to do extremely well with its other medical treatment and the protocol of hyperbaric for over 2 years. Eventually was euthanized due to the fatal nature of its disease, but we attribute the success to hyperbaric oxygen therapy for the longevity of the care. Metastatic cancers. Here's an area that has gotten a lot of attention in the literature and a lot of exposure. Edward Charles Goldfinger, polydactyl cat that was diagnosed with small cell gastrointestinal lymphoma. Treated with chlorambucil, chemotherapy every 2 weeks, hyperbaric oxygen therapy 90 minutes to 88, and prednisone when in hospital, rather prednisolone, because the owner was not very good about giving medication at home. Survival was anticipated of about a year. Survival actually was over 2 years. Upon coming out of remission, Edward Charles Goldfinger was euthanized. Non-toxic metabolic management of metastatic cancer in experimental mice is a novel combination of ketogenic diet, ketone supplementation, and hyperbaric oxygen therapy is one of the later articles. There's another one in 2014 without the ketone supplementation, and you'll see how beneficial it is for lengthening the survival of his metastatic cancers. Other common uses in veterinary medicine: pre-post-op orthopedic soft tissue surgery, anemia, immune-mediated disorders, pneumonia, and dermatitis, and so on and so on. The extent of use of hyperbaric in veterinary medicine is unlimited, as we do not have the restrictions of the insurances and Medicare. What about neurological disorders? This is probably what is the most attention for me, as I am a neurologist, neurosurgeon. So in veterinary medicine, we have a great deal of attention for neurological disorders and the mystery of treating them. So I'm going to start with a video out of a website from Dr. Harsh about a head trauma case. I'd like you to take some time and watch this video. If you get bored with it, please accelerate through this presentation, and you can always go on HBOT.com and look at this video at another time. So here I go. I'm going to activate the video, and then we can go from there. Dr. Paul Harsh is looking at Kurt Allen, October 2004. Kurt was through a severe accident and had severe head trauma, as you'll see from his scars. He's considered pretty much non-recuperable at this time as far as patients are. He's presenting to Dr. Harsh for hyperbaric oxygen therapy. Dr. Harsh is assessing his response to voice, to stimuli. On Dr. Harsh's website, you can have all the sounds, which I cut out here. HBOT.com, Dr. Harsh webpage. Kurt is unable to respond well to bright light, and as you will see, is unable to follow the light, even with his head, not to mention just his eyes. His facial expression is poor. He's on feeding tubes. This is in December, 36 treatments after hyperbaric oxygen therapy. So we are looking 2.5, 3 months later. Visibly still affected. There is now an ability to grab a little bit better, although poor. But he's able to raise his head. He has facial expressions, moving his face, moving his fingers. He is starting to smile, respond with a smile to his doctor. Five weeks since the 40th hyperbaric oxygen treatment. 3.5 months in starting hyperbaric oxygen therapy, 7.5 months of injury. He's got a lot more muscle tone, control. He's able to joke with his doctor about his name. He's aware of the camera. He's following the light with his head and his eyes. Just before the 80th hyperbaric, Kurt is able to stay in a normal sitting position. He's focused on his interlocutor. Talking about his feeding tube that he is no longer using. He's able to eat by himself. He's building muscle mass. He's getting weight. Going to get up and walk with a walker. Two-month break. Recheck. Being able to talk to his clinician, sit in a regular chair. He's able to walk this time with only assistance from his kin, his parent. There's a little bit of hypermetria in the left. July 2005. 13-month post-injury. Kurt is walking with even less assistance. Getting stronger core, stronger limbs. Just before the 90th hyperbaric oxygen therapy, we're talking about a year and a half since this all started. Here he is. Get up by himself. He's able to do something that's rather difficult, easy for us, but not when you're trying to learn. Getting up on steps, turning around. Balance is crucial here. And able to sit himself on the bed. Next step is getting down. What Dr. Harsh is asking him to do now is something to challenge his balance, which is putting his feet together. That's very impressive. And here he is, walking by himself. Reminder, Dr. Hart's webpage is hbot.com. Brain trauma and hypoxia. Here's an example of a patient that presented to us shortly after arresting under anesthesia during a dental. Miss Lucy is essentially only responsive to very obnoxious stimuli, very, very bright light, pinching her feet. She already has an oxygen tube in. But you have to realize that giving oxygen nasally and giving oxygen to an oxygen cage is good for some supportive care. Unfortunately, it will not deal with hyperbaric conditions and will not be able to supplement oxygen where there's already vascular accident. So it is very limited what oxygen can do since it is carried by the hemoglobin only. Here's Miss Lucy after 4 hyperbaric treatments. She's already walking. Her vision was limited and did not recover until just a little bit 2 weeks after incident, but Miss Lucy is able to walk already, recognize her environment. Little loss of balance, but it is about 24 hours later. Hyperbaric oxygen therapy improves spatial learning, it improves cognitive dysfunction, it ameliorates local brain metabolism, and the articles go on and on and on in the literature. Here's a 2-month-old Morkie that was seen by us 3 months after arresting under anesthesia. So the dog had continued to have dementia, crying out, circling, not playing with his toys, not responding to the owner, having to be hand-fed at times. So we started hyperbaric oxygen therapy, and this is after 10 treatments, and the owner pursued 10 more treatments. Just after 10 treatments, this dog is aware of where her bed is. She has gathered up all her toys. She is yapping at the owner who's talking to her. She is trying to listen to her commands, and is now acting like a normal dog. Brain cancer. This is a topic that's particularly close to my heart, and this is why. Meet this patient. Miko is a 6-year-old domestic male-neutered cat, and he has presented to me for changes in behavior, slowing down, circling. When I came into the exam room, Miko very promptly fell on his side and showed signs of brain herniation. We rushed him for treatment in our intensive care and advised an MRI, and here are the results. You can see there's a large white mass in front of the brain, and that mass is actually showing cancer extended all the way to the nose. Then you have here a mass seen from sort of a dorsal plane, which is sort of a sky view of things, and this is a cross section to the brain showing that the midline of the brain is shifted, right side, left side, back of the head. You can see that the brain is herniating, sort of tonguing or lipping back, causing the patient to be recumbent and poorly responsive. So this is very life-threatening. The owner opted for a craniotomy. We proceeded and treated for the intracranial pressure, went to surgery, removed the tumor in the nose and the brain, left a chemotherapy wafer called CCNU, and proceeded with hyperbaric oxygen therapy. Here's our little cat 24 hours later or less, with his incision. This is a cat that was herniating, unable to walk, and less than 24 hours ago had an MRI, brain surgery, couple of hyperbaric treatments. Can't blame him for being a little bit disoriented at first, but you'll see, he's being a typical cat, he's going to look for a place to hide. And here is him in his hyperbaric chamber. He'd been treated with decreasing doses of prednisolone, eventually removed. Every 6 weeks he received CCNU at 50 milligrams per meter square orally and hyperbaric oxygen therapy at 2 ATAs for 90 minutes. Here's Miko, just a few months later. Should be a perfect advertisement for the beer that's sitting in that cooler. And here he is with his friend, little Chihuahua, 4 months after surgery. Here's Miko's MRI. 6 months later, no cancer, no cancer, no cancer. And here's Miko's MRI, 1 year, no cancer. It's pretty amazing considering the lymphosarcoma that was diagnosed in Miko's brain is given an average of about a median of about 88 days of survival. Miko lasted over a year. So here are some articles, and again, this is a limited review, showing that hyperbaric oxygen therapy can influence the response to chemotherapies in brain tumors, particularly in gliomas, glioblastomas, and go beyond with metastatic cancers. Intracranial inflammations are very common in dogs, mostly, occasionally in cats, but there's a disease called GME, and there are what we call septic meningitis and young dog meningitis that can be noted. Extremely aggravating because they cause a tremendous amount of pain and can be very challenging to treat. Here's an example of a patient that presented with severe neck pain and shivers. She had a subacute onset of neck pain, and she had tremors that were generalized. She was what we call obtunded, which is not feeling good and kind of looking depressed. She was falling over at times. The pain was definitely substantial. We did a spinal tap and just going through. This is an example of spinal tap on a hemocytometer. The dark purple cells are white cells. The little brown cells are red cells. On this scan, on a normal spinal fluid, I should see no purple cells. And clearly, this is severe inflammation. We're going to move on to a closer approach. You can see the cytology of these cells. We see what's called a lot of polymorph, which is varying looking cells, varying sizes. They're all inflammatory cells. They're neutrophils. There are some monocytes, a lot of what we call macrophages, which are the cells that come in cleanup. So this dog was diagnosed with a severe meningitis. And what we found is that she went home 24 hours after getting treatment with steroids and the hyperbaric oxygen therapy. Actually, less than that. She went home within a few hours. But within 24 hours, she had essentially no remnant signs to her problem. Most of these cases will take a few days to recuperate from their meningitis, and I do believe that having the hyperbaric oxygen treatment helped her feel better, cover the pain, and promote the anti-inflammation and potentiate the steroids work. So again, I think there's some work to be done, especially in GME, granulomatous meningoencephalomyelitis, a ever so common problem in veterinary medicine. I think there's a window for work there. What about degenerative myelopathy? Many of you have probably heard about this disease, which is sort of called an aging or fading away of the spinal cord in layman's term. This is a very serious disease affecting many breeds of dogs, corgis, German shepherds, Labradors, and so on. Boxers. This disease, unfortunately, is devastating to everyone around it because there is no cure, there is no treatment for it. It is very slow, very progressive, some dogs more slow than others, and it will lead the dogs to become weaker in the back legs, often asymmetric, one leg worse than the other, and slowly or rapidly progress over time to the point of a complete paralysis. A small dog can be put in a cart, but a large dog can be far more challenging. There's a genetic test out there, and there's now a neurofilament assessment test that's being done that is very relevant to the diagnosis, but again, no treatment. So exercises, vitamin supplements, many things have been recommended, but without any good results. We had this corgi, 11 years old, and had a progressive problem over quite a few months. Started 5 hyperbaric oxygen therapy as sort of a, oh, let's try if it works, and had some significant improvement in strength. We went ahead and collected some stem cells in her from her falciform fat, which is right in the abdomen. Those stem cells actually had over 40% more stem cells than the normal patients at the lab. What was interesting is that knowing that hyperbaric oxygen therapy stimulates stem cell growth, it made complete sense. But the patient improving with only hyperbaric was rather a question mark. Was it the patient just feeling good on oxygen, or was it an actual improvement? We injected the stem cells lumbar and cerebellomedullary cistern. On the first injection, the patient was a bit weaker in the left pelvic limb post-procedure there, and I think it was a handler error, i.e. me. We continued hyperbaric for 1 to 2 days, give a second injection just in the cisternal tap at this point, and continued hyperbaric for a total of 22 treatments from beginning. So here's our patient. This is before we went to stem cell therapy, so right before that surgery. You can see that this dog was sent to a neurologist because he had progressive weakness and was significantly bad, had to be assisted at times to get up. And you can see how peppy she can be. Definitely worse in the left pelvic limb or left back leg. But here she is. So whether or not getting stem cell therapy is beneficial, I don't know yet at this point, but I think it's interesting that the hyperbaric oxygen therapy actually helped this patient quite substantially prior to even the collection of stem cells. Does it have something to do with the stem cell enhancement that hyperbaric oxygen therapy gives? Does it just a feel-good mechanism? Don't really know, but it's certainly worth looking into a little bit further. So hyperbaric oxygen therapy provides neuroprotection following spinal cord injury. It improves the local environment after spinal cord injury, and it attenuates neuropathic pain as well. Dementias and behavior changes. Well, this is a field where definitely hyperbaric is being used in humans quite a bit, but I think there's a great deal of options here for our canine and feline patients. This is my personal dog, Oliver Sacks, and Oliver Sacks is almost 15, and he is old. He is getting older by the minute. Oliver, as he was aging, was placed in hyperbaric oxygen therapy here and there and showed some significant stabilization, improvement, increased energy, so we use hyperbaric to just make him feel good. Since he has not had hyperbaric for the last 6 months, he has deteriorated significantly. There are reports in human literature showing that Alzheimer's disease is actually been documented not long ago that it may be caused by microvascular infarcts. So would hyperbaric oxygen therapy come to the rescue of some of these Alzheimer's patients? Post-traumatic stress disorder, which is similar to RAD in kids and could be similar in our dogs who've been through traumas, for example, kennels, shelters, could this be of help? Could hyperbaric be of help for these patients? It certainly is well documented in PTSD, and there are centers running patients, veterans with PTSD through hyperbaric oxygen therapy and seeing amazing results in their recovery and their ability to function as members of their society. So it would be interesting to take a look at our dogs with dementia and our dogs with similar symptoms as ADD, anxiety attacks, and of course maybe traumatic stress syndromes, and see if hyperbaric can save some of these dogs from euthanasia. So hyperbaric, all and for all, is a great ancillary treatment for a number of disorders. Please do not believe it is a cure-all, and it's certainly not a cure by itself unless you're looking at things like infarct, like fibrocartilaginous embolism, strokes, then it can be of use by itself. Cancer management in combination with other therapy, definitely hyperbaric has a role in that, and it should be looked at further. I think in our animals it should be added on to protocols. Degenerative disorders, I think, may have a benefit with hyperbaric. And of course, we have stem cell boosting. So when you talk about animals that may have bone marrow issues or may have some problems producing red cells and may need a boost with a stem cell, then this may very well be a situation where hyperbaric comes into play. So what are the studies in the making? Well, I can't really speak for others, but I have a great deal of interest in looking at hyperbaric with degenerative myelopathy. This is a long study, of course, and it's going to demand a little bit of planning. Looking at surgeries, pre and post-surgery use of hyperbaric oxygen therapy, and of course the use of HBOT with chemotherapy for brain tumors is of great interest to me. Pain management? Possibly. GME, which is an inflammatory disease, I think deserves more to be looked at with hyperbaric oxygen therapy. So let's make the impossible possible for our best friends, and just remember we all learn more by looking than by knowing. For any questions, please feel free to reach us at pinkitup@gmail.com or just simply log in at veterinaryneurology.net. Thank you very much for joining me in this presentation. If you have any questions, comments, I look forward to every one of them.